Dr. Lewis with Spinal Health and Nutrition. Today we're going to talk about something that most people have, especially if they're always working with their hands. That is called carpal tunnel syndrome. So what is carpal tunnel syndrome? That's when the medial nerve gets entrapped underneath this area here that surrounds our wrist called the carpal tunnel. When that happens, that can lead to pain on the hand or the wrist, weakness and numbness, and also limited range of motion. Okay. So oftentimes people who work with their hands, if they work at a desk a lot, on a computer, most people telework, they're on a computer a lot, it's due to repetitive motion on the hand. Mechanics get it as well. People who are like hairstylists, athletes who use their hands a lot, especially boxers, martial artists, they can also get this condition, okay? There is some invasive treatments out there for this, which is surgery, but my goal is to give you some knowledge on some non-invasive things that you can do that will help relieve this condition, okay? Another thing that can do it is diabetes. You go back to my YouTube channel, I did talk about diabetes, all right? When someone is a diabetic, the glucose molecules in their blood are very large. And those glucose molecules are sugar molecules that will start putting pressure on the nerve endings, especially that sensory nerve. And when that happens, not only that they feel numbness, tingling, pain, or radicular pain on the feet, they can also get it around the hands and also around the wrist. It's very important to see your doctor, have them do some blood work. If your blood sugar levels are high, definitely work on that. Work on getting it down. Remember, diet, exercise, get yourself on a nutrition plan, which will help get those glucose levels down to take some pressure off those nerve endings that's causing those problems. And another thing that can do it is rheumatoid arthritis. Rheumatoid arthritis is a autoimmune inflammatory disease when the immune system pretty much attacks the healthy tissues or the healthy cells that we need. And that can also pretty much lead to those ridiculous symptoms around the wrist. So definitely see a rheumatologist if you are diagnosed with rheumatoid arthritis. All right. So those are the symptoms. Signs and symptoms are numbness, tingling, and weakness around the hand. Treatment, once again, chiropractic care. All right. Not only that we adjust the spine, but we also adjust the upper and lower extremities. Okay. And we do this by adjusting the wrist, by removing the pressure off the wrist. We're actually working on removing pressure off that median nerve so that those symptoms start to decrease, okay? And it's going to take some work, and also going to take some simple physical therapeutic exercises to get that hand moving, to get the blood circulating, and also getting the range of motion back to its normal function. All right. There are some supplements to take for this. Vitamin B6 that will help decrease the pain. All right. All right. So oftentimes you may have to do a combination of taking your supplements and also seeing a chiropractor. Magnesium is good to help improve joint function because with this condition, it's going to cause joint restriction. If you are lacking on your vitamins based on your blood work, you're low on magnesium, that may be what you need to take. Your magnesium, your vitamin B6, okay? Your omega-3s, which will help decrease inflammation. Going back to rheumatoid arthritis, which is an inflammatory condition, take those omega-3s. Omega-3s are going to help decrease the swelling or the inflammation that's going to occur around the wrist. Turmeric is good. Remember, with turmeric, in order for turmeric to be effective, you need 1 or 2 teaspoons of that and at least 16 ounces of water with black pepper. All right. Black pepper combined with turmeric is going to help decrease inflammation, help decrease the pain. And also, I mentioned your zinc. Yes, zinc is another good one as well. And they do have wrist splints for that, for carpal tunnel. What it does is that when you wear that wrist splint, it's going to help extend the wrist. When the wrist is extended, it's going to help relieve that pressure off that median nerve. But please do not wear that wrist splint for the whole day. You want to take that wrist splint off, do some range of motion exercises with it, going here, there, You want to do your flexion and extension with that wrist, get it moving. At the same time, please see a chiropractor. Take your vitamins and minerals at the same time. And then you will eventually see the results. Okay. All right. So definitely take care of this. If you are finding yourself doing repetitive motions with your hands and you feeling those symptoms, maybe carpal tunnel. So you gotta take action with this quick, because if you wait too long, what's going to happen is that you're going to get some scar tissue that's going to build up around that carpal tunnel, around that median nerve, and they may have to do surgery to remove that. So, got to attack this soon before it gets worse, okay? I'm Dr. Lewis. Please like, subscribe, share to our YouTube channel, and remember, your health is your greatest investment.